Dear colleagues, my title is Correlation of Postoperative Results According to the Amount of Prostate Tissue Obtained in Patient Undergoing Transurethral Resection of the Prostate. Non-disclosure sponsored by Record.IT. Although many transurethral resection of the prostate methods have been described, there is no consensus on how much tissue should be removed. It was aimed to evaluate the effect of the amount of tissue resected by TUR-P on lower urinary tract symptoms and other postoperative parameters in patients with benign prostatic obstruction. 43 patients who underwent TUR-P between 2018 to 2021 were evaluated prospectively. Groups were created according to the percentage of tissue taken from the patient. Group 1, those with less than 30% transurethral resection. Group 2, patients with more than 30% resection. Patient's age, prostate volume, amount of the resected tissue, operation time, hospital stay, catheter removal time, international prostate symptom score, before and 3 months after surgery, quality of life score, maximal urinate flow, serum PSA and hemoglobin values were recorded. Patients with perioperative and postoperative complications were noted. The mean age of the patients was calculated as 68 years. Tissue taking from all patients was observed with an average of 36% with 27 grams. In those patients, it was determined that the mean IPSS decreased from 29 to 5. The average quality of life reduced from 4 to 0.8. Qmax increased from 7 ml per second to 17 ml per second. PSA decreased from 7.5 to 2.9 nanogram per milliliter. In Group 1 and Group 2 respectively, percentage of tissue taken 22% and 48%. Regression in IPSS 77 to 73. Improvement in quality of life 77.2 to 84. Qmax increased 171 to 193. The decrease in serum PSI 56 to 69. In Group 2, the parameters are statistically significant other than quality of life. In addition, the duration of the operation 38 to 53. Hospital stay 2 and 2.4 days. Catheter time 4 to 4.9 days. Decrease of HB 10% and 14% was determined. Complications were observed in an equal number of patients in both groups. Hemoglobin decrease requiring transfusion in only one patient. Urinary tract infection in 4 patients. Urethral stenosis was noted in 1 patient. In Antunes' study, an average decrease of 16 units was observed in patients with less than 30% resection in IPSS, while a decrease of the 18 units was observed in patients with more than 50% resection. Again, in this study, in quality of life, 3.1 and 4.2 units of decrease were observed. In the present study, in IPSS, an average decrease of 21 in Groups 1 and 26 in Groups 2. In quality of life, an average decrease of 2.5 in Group 1 and 4.5 in Group 2 was observed. With this result, it was noted that the change in IPSS and quality of life was correlated with the resection rate. PAVA showed that resection rate and PSI decrease were correlated, and a 70% decrease in PSI could be possible with more than 60% resection. In the current study, a decrease of 56% in PSA with an average resection of 22% and a decrease of 69% in PSA was observed with a resection of 48%. In conclusion, according to the result of the study, with resection performed at least 30%, there is a significant improvement in symptoms and parameters due to benign prostatic obstruction. However, in patients who are elderly, have comorbidities, and need to have a short operation time, less than 30% resection can effectively regress urinary symptoms and increase quality of life. Thanks for your attention. Have a great Congress.